everyone, and welcome to Webinar Wednesday. I'm your host, Jessica King, and I just wanted to thank you very quickly for joining us today. February is the American Heart Awareness Month, and today we'll have internal medicine physician Dr. Anita Udai-Murthy go over heart healthy tips and, even more important, prevention tips. Here's a little more info on today's speaker. She is board certified by the American Board of Internal Medicine. She practices at the Pasadena Clinic, and she joined Kelsey-Seybold in October of 2013. Congratulations. And a fun fact that she attended medical school at Texas Tech University Health Sciences Center. So don't forget, we'll be taking any questions you have at the end of the webinar. If a question happens to pop up, just type it into your question box, and we'll do our best to address it after the presentation. And now I'll turn it over to you.
Thank you so much, Jessica. I'm Anita Udai-Murthy, and I'm one of the internal medicine doctors at the Kelsey-Seybold Clinic in Pasadena. And like Jessica said, I've been here for about 3.5 years. Today we're going to talk about your healthy heart and healthy you and ways to help prevent heart disease and talk about your heart a little bit. So our first slide is just an overview of what your heart looks like. And this is a really good cartoon. It's a little busy, but it's a really good cartoon. And it's from the American Heart Association. So at the end of the day, your heart is a pump. It is a pump, and it's used to pump your blood to the different organs and muscles in your body. And it's a very sophisticated pump. There's 4 chambers in this pump. You have the right side of the heart that has 2 chambers, and you have the left side of the heart that has 2 chambers. And it receives blood, unoxygenated blood, from the body after the oxygen has been used by the muscles and organs, and it goes into the right side of the heart, and then it gets pumped into the lungs where it gets oxygenated, and then it comes back through the left side of the heart, and the left side of the heart then pumps the oxygenated blood to the rest of the body. Now, the heart is not just a series of chambers. It's also got some valves, and it's run on electricity. So everybody has an internal pacemaker, and the heart has an electric current that starts with the pacemaker, and the current travels down this electric current, and it causes the heart to pump in a very coordinated manner. Sometimes we can have problems with the pacemaker, sometimes we can have problems with the muscle itself, and sometimes we can have problems with the valves. And those are all what's encompassed in the term heart disease. The heart itself is a muscle, so just like any other muscle, the heart requires oxygen in order to continue pumping. And to supply the oxygen to the heart, on the outside of the heart, there are some blood vessels, arteries, and sometimes those arteries can get blocked. And so that's what we talk about when people have coronary artery disease or have heart attacks. So it's a very complex organ. For most people, it works just fine, but it's very complex, and it's a really, of course, vital organ to help you survive. Okay, so of course, men and women are different, and our hearts are no different. Men's hearts are a little bit bigger on average than a woman's heart. A man's heart on average weighs about 10 ounces, and on average a woman's heart weighs about 8 ounces. Men's heart beat a little bit slower than a woman's heart, but in general the heart rate ranges about 50 to 100 times a minute. If you're an athlete, sometimes your heart rate can be a little bit lower than that, and that's normal for athletes. When you are excited or when you're doing physical activity or you're nervous, you require more blood to supply your organs and your brain, and so your heart will compensate for that by beating faster so that your body can get more oxygen. But on average, your heartbeat should be about 50 to 100 times a minute. So heart disease is our next topic, and it is a broad term used to describe a range of diseases that affect your heart, and this is the leading cause of death for both men and women in the United States. We refer to heart disease as cardiovascular disease, coronary artery disease, and it includes conditions that involve the narrowed arteries around the heart that can lead to heart attacks, chest pain, infections, or irregular heartbeats. And what we're going to spend a lot of time talking about today is how we can prevent or treat heart disease with a healthy lifestyle. So heart disease, cardiovascular disease, is the leading cause of death globally, and about 17.3 million deaths per year can be attributed to heart disease. So this is a very prevalent problem, and it's something that we are very aware of as doctors and want to communicate that to our patients. We screen our patients for heart disease, and we screen our patients for cholesterol levels, because we know that cholesterol levels can increase elevated cholesterol levels in certain patients can increase your risk of heart disease. So this is a really big problem, and we want to make sure that our patients know how to prevent it and how we manage heart disease. So the best ways to prevent heart disease are exercise, making sure you eat healthy, making sure you get enough rest, working on your stress, and not smoking, and of course visiting regularly with your doctor. So we'll talk a little bit about exercise. So exercise is the most important key factor to having a very healthy and happy heart. It strengthens your heart, it helps lower your blood pressure, it reduces your risk for diabetes, and it can reduce your stress as well. The type of exercise that we recommend are aerobic workouts. So anything that causes your heart rate to increase is a great workout. So things that I like to recommend to my patients are running, jogging, swimming, bicycling, water aerobics, and Zumba. So any kind of cardio exercise. We recommend that our patients get at least 30 minutes of exercise 3 to 4 times a week. If you can do more, that's even better. What exercise does is it helps keep you in condition, and it also helps lower your heart rate. And as an added benefit, it increases the endorphin levels in your brain, so everybody feels better after a workout. Everybody feels pretty good, pretty happy after a workout. A lot of people have joint issues, especially as people get older, and so exercise becomes harder as people get older. But staying active is very key to living a long, healthy life. So what we recommend is some kind of low-impact exercise, like the stationary bicycle or water aerobics or swimming are very good forms of cardio exercise that are low impact on the joints. But any kind of exercise, even walking is a good form of exercise. What I like to tell my patients is you got to be a little bit out of breath. We can't be having a conversation like how we're speaking right now. But you shouldn't be panting, and your heart rate has to be up, and you got to be a little sweaty, and that's a good form of exercise. Okay, so our next topic is healthy diet, and this is the thing that most people that I see in clinic have struggled with, and the reason is our association with food is very social. People go out to eat with friends, and this is a very social event. Unfortunately, what we choose to eat when we go out are not such great healthy choices. So we got to focus on eating a healthier diet. So what we recommend are a lot of fruits and vegetables. I like to tell my patients to eat a very colorful diet, and I'm not talking about Skittles and M&Ms. I'm talking about fruits and vegetables. So the more colorful your fruits and vegetables are, the better your diet is. Fruits and vegetables contain a lot of nutrients, contain a lot of fiber, and contain a lot of antioxidants. So colorful foods are a good way to make sure you're eating healthy. We tell our patients to avoid sugary snacks and high-fat items and processed foods. And this is not always possible, but if you're eating a lot of sugary snacks or if you're eating a lot of sugary drinking a lot of sugary drinks, we recommend cutting back. And reducing your salt intake is always helpful to help lower your blood pressure and maintain a healthy diet as well. The American Heart Association contains a lot of information, and they also have a bunch of heart healthy recipes at the American Heart Association website, which you can see on your computer screen right there is the website. We recommend more fruits and vegetables and less carbs. And my patients always ask me about a diet, and I hate talking about diets because diets to me are associated with a temporary temporary lifestyle change. And what we really need to work on is a lifestyle change that is more sustainable. So I tell my patients, instead of eating out so frequently, maybe reduce the amount of eating out that you do to 1 or 2 times a week. I tell my patients that cutting out the sugary drinks like sodas and juice and sweet tea will help make you healthier. And of course, a low-carb diet is now what we're starting to recommend for our patients, because low-carb helps people lose weight and is a much healthier diet than a high-carb diet. So when I say carbs, what I'm talking about are foods that are white and beige. So things that like pasta, rice, potatoes, and bread and tortillas and all the things that people like to eat. Instead of eating as much as you're eating now, I tell my patients to cut it by half and eat more fruits and vegetables. There is a few diet plans that have now come into fashion that people have looked into a little bit. One is a Mediterranean diet, and that one is kind of like a high fiber, low carb diet, and some people have recommended that. But I'm not a huge fan of telling people to go on a diet. I think we should all learn to make better lifestyle choices, and part of that is eating more fruits and vegetables. The next thing to keep your heart healthy is to get plenty of rest. The ideal amount of sleep varies for everyone, but on average, people who get about 7 to 8 hours of sleep are less likely to develop heart disease than people who sleep less than 6 hours of sleep, less than 6 hours a night. So make sure you're getting plenty of rest, and make sure you're getting those TV screens and computers and iPhones away from the bed so that you can rest peacefully throughout the night. And then, of course, stress. And it's so easy to tell people to stop stressing, but stress causes so many things to happen in your body. So trying to reduce your stress is always a good thing. So emotions and stress can cause your body to release hormones that can cause significant changes in your body. So things that cause increased amounts of stress are things like recent passing of a loved one, loss of money, a surprise birthday party even can cause a lot of stress for some people. And if you have a presentation or a big performance coming up, and that can also lead to a lot of stress. So stress can increase some studies suggest that stress can even increase your risk of having a heart attack. So reducing your stress is very important. Fortunately, most stress is temporary, and after the stressful event has passed, things return back to normal. Things that will help you reduce your stress, of course, are exercise. Yoga is a good way to reduce your stress too. And some people like to clean, some people like to write in journals, but there's a lot of techniques and tips that you can ask your doctor about how to reduce your stress levels. All right, now this is a big one. In fact, this is probably the most important thing and one of the biggest risk factors associated with heart disease, smoking. So there are numerous studies performed by very large organizations like the American Heart Association, the American Cardiology Association, that show that smoking directly increases your risk of having a heart attack or a stroke. It also increases your risk of lung disease like COPD or emphysema, and it also increases your risk of cancer. But in terms of your heart, smoking directly increases your risk of a heart attack. So we recommend, of course, to all of our patients to not smoke or use tobacco products. And we recommend that all our patients, if they are smoking, make sure they're not smoking within the house, because secondhand smoking is very dangerous as well. Quitting is hard, and we all recognize that, but it is the best thing that you can do to keep yourself healthy. And this is any tobacco products, whether it's smoking, cigars, chew tobacco, even the electronic cigarettes. All of these things have been linked, associated with increased risk of coronary heart disease. Once people quit, it takes a couple months, but then your risk returns back to someone who doesn't smoke. So it is never too late to quit, and your lungs will heal, or will stop, your lungs will not progressively get as worse when you stop smoking. So they will return to they won't return to normal, but they will stop progressively getting worse if you have lung disease and you're smoking. So stopping smoking is a great thing. And of course, visiting with your doctor is an important way to detect heart disease and discuss your risk factors with your doctors. So regular health screenings are very important. It's also important to have a good doctor-patient relationship so that we can regularly screen your blood pressure, your cholesterol, and your glucose levels. And if we do discover risk factors like high blood pressure or diabetes, or if you're smoking, we can determine how we can reduce your risk factor so that we can keep you healthy and happy. And we have many dietitians here with Kelsey-Seybold, and so if you're interested in more information about a healthy diet and portion size, we can always have you set up to see one of our dietitians. So as a recap, what can you do to help yourself stay healthy and help your heart stay healthy? The biggest thing is avoid tobacco and be more active, so increase exercise and make healthy eating habits. So
I think we have some time for some questions now. I actually want to get us started with some of them. So I've read a lot of articles that state that aspirin can help reduce your risk of heart disease. Is that true? Can we take aspirin, or is it too soon to take it? Should we wait?
Jessica, that's a really good question. Thank you so much for asking that. There are a lot of instances where taking aspirin will help reduce your risk of heart disease, but it depends on the person and the risk factors they have. We don't recommend for everyone to start an aspirin, and if you're interested in starting an aspirin, you should discuss this with your primary care doctor. Okay. But some patients do benefit from aspirin, but again, it depends on your age and your risk factors.
Okay, gotcha.
Okay, we have another question. When exercising, what's a healthy heart rate and what is too high? That's a really good question, and we like to see patients' heart rate between 100 and 130 when they're exercising in order to lose weight. Above 140 is a little bit too high, so try to keep it between 100 and 130, 140. And if you feel like you're breathing too hard, or if you're not able to talk in complete sentences and you're probably exercising too much or exerting yourself too much, you need to take a little break or back down a little bit. Okay, I think we have another question. We have a family history of kidney disease. Does this increase the risk of heart disease? That's a really good question, and kidney disease can increase your risk of heart disease depending on what type of kidney disease you have. This also depends on your other risk factors as well, such as if you have high blood pressure and diabetes as well. If you are worried about your risk of kidney disease and heart disease, that is a really excellent conversation to have with your primary care doctor. But that is a very good question.
I have one real quick. Are there any vitamin supplements that we can take to reduce our risk of heart disease?
Thank you, Jessica. That is a really good question. Vitamins are a little tricky. There are no studies that show that vitamins in general reduce your risk of having heart disease. What we know is more of a healthy diet and exercising and regular visits with your doctor and stopping smoking are more important than taking a multivitamin or fish oil or things like that to help reduce your risk of heart disease. Okay. So in certain cases, certain doctors will recommend vitamins, but in general, that we would recommend starting first with a healthy lifestyle.
Okay.
We have another question. What is the optimum length, mild or strenuous exercise per workout? So we recommend people work out for about 30 minutes at a time, and you work out so that you're just a little bit sweaty, and you're working out so that your heart rate comes up a little bit, and you're a little bit out of breath. We recommend 30 minutes at a time, at least 3 to 4 times a week.
I'm going to tack on to something. This goes back to a diet question. Do you think that plant-based diets are better than meat diet? I mean, not meat diets, but a lot of people say that you're supposed to cut a lot of your red meat out of your diet for a healthier lifestyle in general. So is there...
Definitely. Cutting back on red meat will definitely keep your heart healthier because it has less, a plant-based diet will have less cholesterol than a red meat-based diet. So like we were talking about before, increasing your fiber with fruits and vegetables will keep your heart healthy, and lean proteins. We always recommend lean proteins, so things like baked fish, chicken, and even tofu, for those of you that like tofu, are really good forms of lean protein that will help keep you healthy. I'm not saying don't eat steak or beef fajitas, but moderation is always the key. Okay, we have another question here, and it's about a patient who has some blockages in their arteries, and their doctor put them on an aspirin and a statin, and the patient has started working out. Good job, way to go, and changed their diet. Great job. And the question is, will this help prevent more plaque, or should they consider starting a statin? That's a really good question. And I would recommend definitely keeping up with the working out and definitely keeping up with the dietary changes, and definitely staying on the aspirin. What will happen is that these changes will definitely reduce the risk of further plaque from developing. But in order to really reduce your risk of plaque from developing, a statin will definitely help with that. I would definitely advise you to follow up with your primary care doctor once you have implemented these changes to reassess how these blockages in your arteries are progressing. Okay, and then we have another question here. If you have degenerative discs in the neck and back, what are the best exercises to get the heart rate up? Really good question. We have a lot of patients who have back problems and knee problems, and the best exercises are exercises that are low impact on these joints. So things like the stationary bicycle, water aerobics, and swimming are all great forms of exercise. Okay.
So we've been talking about a lot of preventative measures. What about if you have a heart disease? Can you reverse that? Is there something you can do to make your heart better?
There are some instances when you have heart disease that getting on your medications and getting regular follow-ups with your primary doctor and with your cardiologist, some instances the heart can actually improve. We would only know that with reassessment over time. And what was the second part of the question, Jessica?
If you can reverse it.
Oh, you can. Sometimes it is not reversible, but the function of the heart can come back. Definitely by staying on medications and a healthy lifestyle, if you have heart disease, can prevent further heart damage and further disease from progressing.
Okay. So I have a question, kind of going back to my baby aspirin question. So it's supposed to be a blood thinner, which it makes blood flow easier, right? So is there any natural blood thinners that we can try instead of taking aspirin or any pills or medication?
Not really. Aspirin is really, if your doctor recommends aspirin, there's not really any natural aspirin or alternative form of blood thinner that will do the same job as an aspirin. So aspirin is a pretty benign drug. There are some side effects that can be associated with aspirin, which you'll have to talk about with your primary doctor. But most people that go on aspirin tolerate the aspirin.
Okay. I have another question. It might be a common sense question, but I want to ask it just in case. What is a good blood pressure to be at before you get into a risk factor?
Great question, Jessica. Normal blood pressure is 120/80. and that is a normal blood pressure, and that's what we compare all of the other blood pressures to, is a normal blood pressure. When we start treating blood pressure, typically your blood pressure is over 140, and that's a risk factor when you have blood pressure over 140.
Is there a difference between having a high blood pressure and a low blood pressure based on a heart disease, or is it only high blood pressure is you're in the risk factor for heart disease?
So most of what we see are patients who have high blood pressure that have heart disease, but people can also have low blood pressure and have different types of heart disease. Remember when we were talking about how heart disease encompasses a whole range of different heart problems, and there are some heart problems that can be associated with low blood pressure.
All right. Okay, I think that is actually all the time we have for questions today, so I want to wrap us up real quick and give you a big thank you for doing such a great job
today.
Thank you,
Jessica, for having me.
Yes, and thank you all for joining us this month. This is going to conclude our webinar, and you just received some great advice on how to keep your heart healthy and strong, and we hope the information was helpful and you'll be able to use it in your future. I want to remind you to be sure to join us for our next webinar on March 1, Balloon Sinuplasty, What You Need to Know, featuring ENT, ear, nose, and throat physician, Dr. Prasad. You can tune in and see if this procedure will help you with you and your blocked sinuses, see if it's going to be right for you or an option. And don't forget to follow us on social media and join in on the conversation. Thanks again for tuning in, and we'll talk to you all next month.
Thank you so much.